PHIG funding, our workforce was extremely burnt out from the COVID response. And there was a huge need to really bolster our workforce and work on retention strategies and find ways to bring in additional people in the workforce for public health because we had lost a lot of employees, really good employees, because of the COVID response and the stress involved with that. Well, one of the very first things that we did with PHIG funding, there was so much information coming at us on our PHIG team. The information that we were sharing, that we were receiving, it wasn't being sent out to everyone. So we thought one of the best ways that we could solve that problem is to begin curating a list of national public health professional development resources that are coming in through our partners. As well as free training and paid training opportunities based on public health professions, and also state. We have all of these awesome state associations and resources too, but a lot of the information wasn't sent out. So we thought, okay, let's curate this information. Let's put it all together on a website. We call it our Public Health Training Hub. It's on our Utah Department of Health and Human Services website, so anyone can go to it and find out what resources and tools that they could have available to help support their workforce and professional development. The Public Health Infrastructure Grant allowed us to hire the people to help make that happen. We saw a definite gap in recruitment. We have some amazing universities in the state of Utah, and the Utah Health and Human Services Department is right in Salt Lake at our capital. So we decided to put together an academic health department. We're working on that MOU right now with our University of Utah, a Salt Lake County Health Department, and then the Utah Department of Health and Human Services. And our first step in that academic health department is creating an MOU to offer opportunities for students at the University of Utah to find out more about public health, whether that be through a fellowship or a practicum or an internship, and not only through those programs, but to also create kind of an opportunity for those students to learn about different professions within the public health sector on both the state and the local level. We want students in Utah to be able to know what public health opportunities are available to them at the state and local levels. Even though there are more than enough qualified students, there just is a lack of knowledge about these opportunities. So we want to be able to recruit our students and keep them in Utah and help bolster our economy and our workforce. Through this MOU, it'll help build up and bolster our workforce, but then also the retention aspect of it. Professional development is extremely important to our workforce. We want them to have resources that they can utilize even when public health doesn't have funding available to help support the professional development. So having these free resources to help develop or offer professional development resources for these people working in the our public health workforce gives them opportunities to keep moving forward within public health without having to leave the state. So the Public Health Training Hub helps substantially for the retention portion of it. That also includes letting them know about scholarship opportunities that are available on the national level that they may not have been otherwise privy to. So we try to curate all of these opportunities on the Public Health Training Hub to help build up that professional development, retain the employees we have, and all that together builds up our economy in general. It's never been done before. Like this type of flexibility that the federal government is offering our states gives states this huge opportunity to address those gaps that they find in public health that they may not have available through state funding. We want, all of our work, it evolves around just supporting our community and making sure we have a healthy and safe environment for the state, for all of the people that live and work in Utah. And PHIG is the Public Health Infrastructure Grant. It gives us that opportunity. We never had it before, so it's been really exceptional to be a part of.